It used to be, when you got hurt, a doctor would say, take 2 of these and you'll feel better in the morning. But soon, rather than prescribing pills, doctors could be sending you home with virtual reality instead.
If you hurt yourself, the instinct is to rub it. And in essence, what you're doing is you're distracting your brain by putting in additional signals that are benign signals and overwhelming the brain's ability to feel the painful signal. Essentially, what VR is doing is kind of like massaging the brain and sending signals like a massive spotlight straight into your brain. It's so overwhelming that the mind is not capable of thinking about these other things, like the pain signals coming from the toe.
Doctors like Brennan Spiegel are testing VR across a wide range of medical applications. But the big one is pain, specifically chronic pain. With the nation in the throes of an opioid epidemic, finding non-addictive ways to help people manage chronic pain is an urgent public health need.
What we've shown is that we can reduce pain by almost 25% without any opioids, with tremendous results compared to a control condition. So we did a study where we had 100 patients, and half of them got virtual reality for just 10 minutes, and the other half got to watch the really nice relaxation videos in 2 dimensions. And when we compared them head-to-head, the VR outperformed the relaxation video by a long shot. So what did you think?
It's pretty relaxing. Almost made me forget I was here, like 'cause you're there.
Spiegel and Cedars-Sinai are working with Los Angeles company Applied VR to run the clinical trials. They've already shown that shooting balls at red teddy bears can have a big impact on acute pain. So now they're testing content meant to have longer-lasting effects. Content that facilitates mindfulness, meditation, and cognitive behavioral therapy. VR might be new, but these pain management techniques are well established. VR just helps immerse and engage people who might otherwise be turned off by them.
We see VR as a way to teach them breathing skills by putting them through a guided breathing exercise in VR, going through biofeedback to actually learn that they can control their heart rate variability, that they can actually control factors inside their body through practice of breath, attentional focus, and different self-regulation. That we can teach them through the power of distraction that you can shift your focus onto something else. And that thing at the moment may be VR, but the end goal is to teach skills using technology, not to depend on it for the relief itself.
Which means the real power of VR for treating pain may not be what people see behind the goggles, but what happens when they take them off. Spiegel is now starting a new trial to see if VR can actually reduce opioid use. If it works, doctors might soon start prescribing fewer pills and more virtual reality.